Now, British women are now the fattest in Europe, whilst British men come second only to those in Malta, according to new figures. The latest proof of a growing trend towards obesity. Well, in the 1950s, this is what your typical British man and woman looked like. The average man weighed 70 kilograms or 11 stone and had a 30-inch waist, whilst a woman tipped the scales at 53 kilograms or 8 stone 6 and measured just 27 inches around the middle. Today, though, things look very different. Men have gone up to nearly 82 kilograms, 12 stone 12 pounds, with a 37-inch waistline, and women are now over 70 kilos, 11 stone 2 pounds, with a 34-inch waistline. According to the European Health Interview survey, that makes British women the fattest in Europe, with nearly a quarter registering as obese, while British men come only second to Maltese men, with just over 22% being officially obese. The big concern is the health implications and the strain they could put on our health service. According to a report in the Lancet Medical Journal this summer, obesity will lead to an extra 668,000 cases of diabetes, more than 460,000 cases of heart disease, and 130,000 extra cancer cases over the next 20 years. Treating the conditions will cost the health service an extra £2 billion a year.
Other countries tend to have a much more sensible approach to food and cooking. I mean, particularly the survey shows that we're 4 times fatter than French. Now, in France, there is a much more culture of eating slowly, cooking the food, taking the time, getting the right food, and not rushing down to the local supermarket and grabbing something off the shelf. That is the basic difference between the two.
Let's talk now to head dietitian at Heart UK, Linda Main, who joins us in the studio. Hi, Linda. Nice to see you. From your perspective, it's the health issues that are concerning.
Absolutely. Heart UK sees this report as very, very worrying, because it means that all the public health measures that the government have put in place, this government and previous governments, are actually not working. And it means the predictions of the Foresight report, which was published in 2007, that said 2 out of 3 men and 3 out of 5 women by the year 2050 would be obese, are on target and likely to come true.
What do we do then? I mean, just talking about France there and the different attitudes the government, what the government does there, do we look at other countries enough to say, OK, so your rates are much lower than ours, what are you doing and we're not?
Well, there are public health measures that we should be looking at, and I think one of the key ones is education and support, and helping our young people to be more passionate about looking after themselves, and to give them the skills that enable them to do that. So that's all about loving being more physically active, having the skills to cook healthier food, and having the will and the knowledge to be able to look after themselves on a long-term basis and prevent this obesity from happening. More
women are likely to die from problems associated with obesity than smoking-related problems. Non-smokers in women live longer than health issues related to obesity. We can't, as a nation, be unaware of the health implications of obesity, are we?
We can't, and Heart UK is passionate about preventing premature death caused by heart disease. And these statistics show that heart disease is going to be even more prominent in our society in years to come. We know that 6 out of 10 adults in the UK already have raised cholesterol, and high rates of obesity are going to push those levels of cholesterol ever upwards. And we also know that more and more people are going to become diabetic, and that in itself is a single risk factor for heart disease. So we're going to see more premature death from heart disease unless something is done to tackle these obesity figures.
Very worrying, Linda. Thank you for talking to us today. Linda Main there from Heart UK.